So our next speaker, you've met her already, Dr. King, but it's a little bit of a unique session. We're also going to have Dr. Mary Montero. She's an assistant professor of medicine at Indiana University School of Medicine. She's also the medical director for the Behavioral Health Services at IU North Hospital, which is one of our branches up north. She is probably well known to many of you. She's done a number of webinars and case-based presentations and things on our social media channels and with even some of our support groups as well. She's really taken to heart the mission of the AIHA and support and advocacy of patients, particularly in the realm of mental health. She's a health psychologist who specializes in psycho-neuroimmunology and mind-body connection, which really thinking about the brain-gut axis and how the nervous system works with our gastrointestinal tract as well. So in this talk, we're going to have Dr. King talk a little bit about alcohol. And actually, Lindsay, if it's okay, she told me this morning that this has been one of the hardest talks that she's ever been assigned. So we wanted to ask the hard questions. And in fact, in the past 6 conferences, we've never really directly addressed alcohol use. And we thought it would be relevant to have Dr. Mary Montero as well with us to kind of help navigate some of these things and what we decide about alcohol collectively. So thank you both for coming.
Thank you for the introduction again, and what a great talk by Dr. Nephew. I really look forward to learning what we as physicians can do more for our patients with this disease. As I told Craig, this was one of the hardest talks I've been asked to give, and in true transparency and honesty, I do not have the right perfect answer here, so I'm going with my clinical judgment and extrapolating from some other liver diseases. So I thought I'd start just with a polling question, which is, has your doctor ever educated you about alcohol use? So, see if this works. Give it a few more seconds. Okay. All right, so I am at about 50% yes and 50% no right now. So I will try to do some education and learn with you here. So navigating alcohol and autoimmune hepatitis. So I'm going to give a little bit of an overview, and then I'm very lucky to have Mary here with me to help talk about the psychological aspect and navigating some of this. So I'm just going to start with, what's a drink? You know, we say avoid alcohol or limit the number of drinks. So what is a drink, actually? So a standard drink is any drink containing 14 grams, or about 0.6 fluid ounces, of ethanol, which is the chemical compound of alcohol. So that's a 12-ounce beer, about 5 ounces of table wine, or about 1.5 fluid ounces of hard liquor. So for just healthy individuals, not patients with autoimmune liver disease, not patient with liver disease, what recommendations do we have about what's a safe amount of alcohol? The U.S. Dietary Guidelines on Alcohol Consumption for 2020 to 2025 says that for adults who choose to drink alcohol, women should have 1 drink or less in a day, and men should have 2 drinks or less in a day. Why are the thresholds lower for women? So alcohol, when it comes into the body, is absorbed and then distributed among body water, and women, pound for pound, have less body water than men, and so they have higher blood alcohol concentrations with the same amount of alcohol intake. So what's heavy drinking? So just those thresholds that I showed you, the 1 drink a day for women or 2 drinks a day for men, they're not an average over the week. They are a daily threshold. For women, heavy drinking is 4 or more drinks in a day, or 8 or more in a week. For men, that's 5 or more in a day, or 15 or more in a week, and that's heavy drinking. And then binge drinking can very rapidly increase the blood alcohol concentration and should be avoided. So you said about us, I got half and half, 50% of people have been asked about alcohol use, 50% have not. It is really recommended that we screen our patients for alcohol use. And just in all patients since the COVID pandemic, alcohol has been on the rise, and actually alcohol liver disease has really been on the rise. And so we are trying to incorporate some more systematic screening into our clinics not just for patients with liver disease, but to screen people who may have alcohol use disorders. So you may see more people asking about this, and we really should ask about it and normalize this in our clinics. So this is the Audit C, or the Alcohol Use Disorders Identification Test Concise. Basically, there's a set of kind of 3 questions. How often did you drink containing alcohol in the past year? How many drinks did you drink on that day when you drank? And then how often did you have 6 or more drinks on a day? And you fill that out, and it's a scale of 0 to 12. And the higher it is, the more likely that alcohol may be affecting health and safety. And greater than or equal to 3 in women and greater than or equal to 4 in men is considered positive and should lead to delving into more questions. Doesn't mean someone has a disorder, but it should lead to further questioning. So we are actually trying to kind of incorporate this more standard into our intakes in clinic and our computer system. So back to chemistry. I've done biology earlier. We'll go to chemistry now. Alcohol, the chemical name is ethanol. It gets broken down in the liver to acetaldehyde and acetate. And acetaldehyde and ethanol are toxic to those hepatocytes, those liver cells that I showed you. So what happens? Well, when ethanol and acetaldehyde damage the liver cells, they recruit the innate and those adaptive immune cells in, and then that further damages the hepatocytes. Alcohol can also cause steatosis, or fat accumulation in the liver. Alcohol also disrupts that intestinal microbiome and gut permeability and can lead to bacteria getting into the liver. That leads to more inflammation, recruits more of the immune system, and can lead to more damage. So do we have guidelines? I searched high and low for guidelines in autoimmune hepatitis. I searched for studies of alcohol use in autoimmune hepatitis, and there really is nothing out there specifically for autoimmune hepatitis. So we have guidelines, as I showed you, the AASLD guidelines for alcohol-related liver disease. And what they say is patients with alcohol liver disease or other liver diseases, in particular metabolic dysfunction, associated steatotic liver disease or fatty liver, viral hepatitis, and hemochromatosis, which is a disorder of too much iron, should be counseled there's no safe level of drinking and that they should abstain. Do our societies go into any more detail? So this is the MASLD, or metabolic dysfunction associated steatotic liver disease guidelines that were more recently published, and they talk about alcohol being a cofactor for liver disease progression and intake, and it should be assessed on a regular basis, so something like the Audit C. And patients with clinically significant hepatic fibrosis, remember I told you scar tissue was 0, no fibrosis, or 4 is cirrhosis. So if it's kind of at F2 in that middle or above, should abstain completely. And abstinence, particularly for those with moderate or heavy drinking intake, may lower the risk of fibrosis progression and hepatic and extrahepatic malignancies. So this is more in the metabolic-associated liver disease population. This is not specifically for autoimmune hepatitis. But we take these 2 societal guidelines and we try to apply it to us. Thought I'd just talk about for a minute, why do we worry about it more in patients with metabolic dysfunction? Well, there is synergy of alcohol and metabolic syndrome. So if we look at patients, red is the high waist circumference, blue is low, so abdominal kind of adiposity or fat. If you look at alcohol use, and you look at the same amount of alcohol use, those with higher waist circumference have higher incident liver disease. And if you look at diabetes here, so this is no diabetes, and this is diabetes, same amount of alcohol consumption, look at the risk of incident liver disease when patients have diabetes. So they compound each other here. So then if we look at metabolic liver disease and those patients who actually have cirrhosis, okay, people who already have cirrhosis who have metabolic liver disease, and we look at the mortality of non-drinkers compared to moderate drinkers here, look at the difference. We look at the risk of liver cancer in moderate drinkers compared to non-drinkers. So again, this is a different liver disease, different pathophysiology, although I did tell you that there is an overlap in about 15 to 30% of cases sometimes. And we do have a higher risk for metabolic disease in our population these days. So what am I going to tell you about autoimmune hepatitis? This is not science. You need to talk to your doctor about the recommendations for you. But I do feel like when I'm talking to my patients, I do need to come up with a tailored recommendation for them and have some concrete recommendations. So please take this as you need to speak to your doctor about what is safe or not safe. I polled a bunch of my colleagues about this and tried to come up with some consensus here. But in patients with cirrhosis, there's no safe amount of alcohol. And in general, regular alcohol consumption should be avoided. There's probably a safe amount of alcohol intake for patients whose autoimmune hepatitis is in remission. And it's been, in that sustained remission where the liver tests are normal, and they don't have advanced fibrosis, okay? They don't have the F2, F3, F4. But research doesn't really guide us here. So I tell my patients, if you want to drink alcohol, you need to stay well clear of those US dietary recommendations, which was, 1 drink a day or 2 drinks a day. It shouldn't be on a daily basis. 1 drink a day for women, 2 drinks a day for men. We should stay well away from that total. Some people will say, limit it to a special occasion. We should avoid no binge drinking. And then we have to think about metabolic risk factors, right? It's not the same, I tell patients need to be in remission, need to not have advanced fibrosis. But if patients have diabetes, it's going to be different from someone who doesn't have diabetes. We think about the metabolic syndrome and mental health disorders that alcohol may impact too. And I think if you're at risk for metabolic liver disease, if you have an elevated BMI or you have diabetes, then there's a higher risk for liver disease progression with alcohol intake. So that's what I have. I'm happy to take questions, and I'm excited to have Anne Mary here to help talk about. So I just told you, how do we navigate this in and day out life? So.
Thank you, Dr. King. I am substantially shorter than Dr. King, so I'll move the microphone. Thank you so much for having me. So I'm Dr. Mary Montero. I'm a health psychologist. Honored to be here with Dr. Lammert and Dr. Chalasani, my first boss here at IU Health, now about 15 years with the program. So I would echo what she emphasized, that there is no one-size-fits-all recommendation. Everyone's health profile, health experience is unique. Similarly, their psychological experience is unique. And so how you feel about your liver condition and how that impacts you socially is also unique to you. Dr. Lammert shared that he had some patient inquiries about how to handle alcohol exposure or the prevalence of drinking in social settings. And I imagine with the holidays coming up, a lot of people will encounter circumstances like that. So let me ask, is this a concern that's on people's minds, or how can we tailor interest to you? Yep. Oh, it wasn't a question about that. Can I just ask by a show of hands, is this something that's on people's minds, how to navigate social settings with alcohol? Great, so thank you. Let's go ahead and take that question. I think when we look at that issue, what stands out to me is a couple of underlying factors. One is social, what psychologists would call social anxiety, the fear of judgment or some negative appraisal by other people. In other words, people would look down on you and see you negatively. You might stand out or feel different than others. I had a patient just last week who has had a problem with alcohol, who was diagnosed with liver disease and was planning an elaborate set of circumstances in order to be able to look like she had a drink, so she was fitting in, but she was planning to go get a Diet Coke at the bar with a lime in the same size glass that was for alcohol but did not contain alcohol, because she didn't want people asking her about why she was or wasn't drinking. And I think underneath that, the other issue that comes to mind is stigma. That people not only would judge you for doing something differently, but if they were aware of your condition, would they have pre-existing bias or pre-existing ideas about what that meant? And that can be a very heavy weight. Not a lot of people are aware of autoimmune hepatitis. I think the word hepatitis connotes some old ideas about, I think I'm seeing some nods from the audience. People think of alcohol abuse sometimes when they think of hepatitis and aren't educated about the connections or non-connections with autoimmune hepatitis. And so the people may be afraid, if they are aware that they have something that has hepatitis attached to it, that people will jump to conclusions. And you may or may not be ready to share anything about your health status with other people, especially in a social setting where people are probably keeping it light or looking for not heavy interaction. And so I would encourage navigation very carefully in those settings. identify social support, someone who is able to be aware of your feelings and be of support to you, whether or not you disclose about your health circumstance. If you're uncomfortable, it's no one's business but your own, in my view, what your health circumstances are. It's between you and your physician, what you determine is appropriate. Dr. King outlined that there are no safe levels of alcohol, but I would identify with your physician. You can determine, based on your own health factors, what that means for long-term alcohol use. Is that fair to say, Dr. King? So I don't want to misspeak. I'll let the physician speak to what's technically safe, but from a psychological perspective, I would add the emotional risk of being in those settings is also significant and something to be mindful of. And you may want to plan ahead if you're going to have an event like my patient where you make a plan for how you expect to behave. Also plan for some support after that interaction or that social setting so that you can come back and debrief. That may be with someone from the AIH community. You all offer a very unique set of like social support network options for each other. And the research is really clear that that offers great emotional and psychological protection. So finding people who do know about autoimmune hepatitis and are educated and can understand what you're going through is likely to be an excellent resource for you. So let me add with that, if it's okay, we could take some questions.
So just to get you all thinking, and maybe to go back to Dr. King, I'm in the back over here, sorry. We dreamed up this topic because this has come up more and more in my clinic, at least, in terms of risk-benefit of alcohol consumption and its use as whether it's something to feel normal again or to quiet a symptom. So I just found it quite fascinating, particularly when we turned to our social media channels to really ask patients what they were hearing from their doctor. So if I could ask for maybe just even a few volunteers, all ends of the spectrum, have there been patients that have been told absolutely not, no alcohol? I'm assuming that's the case. Is there anybody willing to share what their doctors talked to them about, even small amounts of alcohol? And just more to give a perspective, I think.
So I've been diagnosed for about 19 years now, and I think the most frustrating thing is I've never gotten a consistent answer, because I've had 3 doctors, and 4, including a nurse practitioner, and they seem to, I ask them, what's the safe alcohol use? I feel like they don't want to, be a killjoy and tell me no drinking at all, even though, I had a hunch that I probably shouldn't be drinking at all. So I finally had to push the issue. I was like, is it safe? Just tell me, just be honest. And they're like, yeah, no. But I really had to push the issue because I feel doctors themselves don't want to, like I said, they don't want to, kill my party, so to speak, But which I'd rather be alive than, I'd rather hear the truth than just, what comforting lies, as they say.
Well, my doctor told me that the best thing, when I asked him about having an occasional glass of wine or something, he said that no, but if you feel like you want to have an occasional glass of wine, he told me that it's okay, as long as it's, you're not abusing, and just occasionally, not a glass of wine, at every social setting or, every holiday or something like that. Just if I decide to have a glass of wine, maybe at Christmas or something, He said a small amount and nurse it for the whole time.
Thank you.
I don't know if anyone else can relate to this, but I was diagnosed when I was a minor. So, obviously a doctor is like, no drinking, you're not of age. And I was fine with that because I wasn't that used to drinking alcohol, but definitely social settings were very challenging. And I did the same thing. I would get, not Coke, but sparkling water and put lime. And that worked pretty well. And I felt like a lot of times I felt like I had to use the autoimmune hepatitis to be like, hey, don't judge me. But now I'm just kind of okay with it. It just takes time.
Hi, everyone. I'm Mariel. My previous doctor, not my current one, would say no alcohol at all, not even on special occasions. But I figured I'd try it anyways to see how I would feel because only I can make that decision. So I would, on occasion, have an alcohol, drink, maybe half of one, and once in a while. So I know what my limits are and how I felt afterwards. The benefit to not drinking is I save a ton of money. So there you go.
So he already identified himself as the most senior hepatologist in the room. I wonder, Dr. Chalsani, would you mind speaking to how you would counsel a patient regarding alcohol in autoimmune hepatitis?
Thank you. Thanks for reminding me. I'm the oldest hepatologist. So I think Dr. King had said nicely. I think if they have advanced fibrosis or difficult to treat, that's not one where I recommend to just open new doors of issues, complications, and those sort of things. That's one. The other is the concern for dependency. If there is family history of alcohol or alcohol use disorder, that's one you just don't even want to go there. But for patients, some patients I've seen now for 25 years or so, I have deep confidence in them, and if they want to have ceremonial, kids' weddings, birthdays, and I think it's reasonable if that becomes, but I think you have to sort of know the patient well, and you, rather than just one recommendation, you have to tailor it to your patients.
I think that's why it's so important to have this dialogue with your doctor, in your individual cases.
We have one more point, and then maybe I could ask the audience. I think, Caitlin, you gave a perspective of what you do in social settings. Does anybody have any other tips or tricks that they could share?
So I just have a question, in terms of if you have that occasional drink, do you recommend that you also have it with food? Because from even before, right, people being diagnosed, when you drink on an empty stomach, you probably feel it a lot more. So if you're going to do that and have the occasional drink, is the recommendation to obviously also have it with food or not? Maybe that's not obvious or not. I'm just curious if there's any thinking around that.
When you have an empty stomach, you can have higher levels. So I think, it can be helpful to have some food in that setting, but that doesn't mean you can have more alcohol, if you have food with it. Also, many patients, let's say we get a patient into remission and there isn't much fibrosis and they don't have metabolic risk factors and they go to have that special drink on an occasion. I showed you what a standard drink is, but people haven't had alcohol in a long time. Going and drinking, a full 12-ounce beer or a full glass of wine can have some effects on people. So you want to start very small.
So for those of you who are new to it, I think it's hard at first, but then after a while it gets like second nature and doesn't become a big issue. So I've always, I live in a state where cannabis is legal. I've always been too afraid to ask my doctor, but I'll ask it here in a huge room where it's not legal. What do you think about cannabis?
It's a great question, and one of the reasons I have to leave this afternoon is because I've got to go back to a liver transplant symposium we have, and we have a whole talk on marijuana, cannabis use, and liver transplant, and the safety of it. So I'm going to learn a lot more because I tasked one of my colleagues with giving this talk. I think in learning from looking at our slides recently and actually thinking about this in liver diseases in general, we also know that there's some role for cannabis in some diseases and treatment of things and nausea and appetite and things like that. There is something called cannabis use disorder where you can depend on it for management of anxiety and other things like that, and I think it should be avoided in that setting, but in general, cannabis use is not going to worsen your autoimmune hepatitis. So.
And if I may add from a psychological perspective, the last neuropsych conference I attended had whole segments on this describing how many elements to cannabis we are not aware of in terms of the full range of their effects. I would add the comment that I think it's especially important that you are candid and open with your healthcare provider. cannabis, apart from worry about judgment, can have impact on your GI system, certainly is important to know for your coping. Often, I find patients use that in the setting of under-identified anxiety or sleep challenges. And so we absolutely want you to have support for sleep and worry. Like, we don't want you to white knuckle it, but we want to do it, and we want to help support you in ways that are safe and not providing risk of some other interaction in the body. So I'd encourage an open discussion with your provider about that. You can keep it in the theoretical, but at least for them to know what you are considering, I think is really important, so you can be educated and make decisions about what's appropriate for your body, given your particular risk factors, if that makes sense.
And I would echo that in talking to your doctor about it, because at least in the transplant literature and some of the medicines, tacrolimus, that we use for immunosuppression, which can also be used in autoimmune hepatitis, there can be impacts on the absorption and metabolism of that, and so drug levels can vary, and so it is important to know that patients are using it, especially when the levels go up.
Great. Thank you, Dr. King, Dr. Montero, for embracing this challenging topic. We appreciate it.